medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Cellular senescence is characterized by the irreversible arrest of proliferation. It is a pro-inflammatory state, and it's characterized by the evasion of programmed cell death mechanisms. Senescent cells are xenomorphic, which means they give off pro-inflammatory substances, and thereby they impair normal cellular operations. Diseases that are associated with accumulation of senescent cells are things like neurodegenerative disorders, Alzheimer's, Parkinson's, osteoarthritis, idiopathic pulmonary fibrosis, and often iron burden correlates with the disease severity. A difficult treatment impasse using chemotherapy is the large accumulation of these senescent cells, which causes drug failures way too often. Senescent cells, regardless of what caused them to begin with, accumulate vast quantities of cellular iron, up to 30 times. Ferritin, which is the blood test of iron storage levels, provide a great biomarker of cellular senescence for associated iron accumulation and resistance to iron-induced toxicity. Cellular senescence is associated with impaired what they call ferritinopathy, explaining associated iron accumulation. Iron accumulation in senescent cells is driven by impaired ferritinopathy, a lysosomal process that promotes ferritin degradation and what we call ferroptosis. Senescent cells are highly resistant to ferroptosis. And ferroptosis, what is it? It's a unique cell death pathway distinct from apoptosis, which we all know. It's reliant on the availability of iron, which is liberated through the ferritinophagy. Now, cellular iron storage protein, ferritin, is elevated more than tenfold in senescent cells. Now, what's the bottom line of all this? But it's kind of confusing. I get it. In my opinion, ferritin is an important blood test for your patients, not only as an acute phase reactant, which could exhibit in acute inflammatory processes or chronically appear outside of, for example, genetic diseases like hematomacrosis. Well, it could be an excellent marker for the accumulation of senescent cells and particularly a biomarker of aging. So if you're not already incorporating ferritin into your composite of blood work when you see someone, first as a baseline, secondarily to look to see if someone's aging or they've been sick where iron has been sequestered into the bone marrow as ferritin, you're missing out on a lot of information about your patient. I hope this was helpful. Thank you for watching. And for more information, go to drmitchghen.com. That's DrMitchGhen.com.